morning, everybody. My name is Blake Briggs. I'm an assistant professor at University of Tennessee, and my partner here, Dr. Hussein, is at Wake Forest University in Winston-Salem, North Carolina. And we appreciate you all coming. Both of us are going to talk about an interesting topic today that's near and dear to both of us, which is talking about framing modern education in smaller doses, bite-sized doses. Something that you may have heard about, there's been energy about it, but we want to focus more on that. Here's our objectives. We're not going to read them off, but just talking about evidence behind this and methods to institute this in a very easy way that's not a huge hurdle to overcome. We don't have any financial disclosures. No one's paying us to be here. It would be remiss to say that both of us run our own podcast, as most podcast speakers do, right? They have their own side thing. We do have our own medical education platform. No one's paying us for anything to be here. We're on here on our own accord, here to happy to share trade secrets, I guess, as you might say about this.
I'd be interested to know, how long is too long for like a podcast episode or some sort of learning content for you guys? Like, how many folks think an hour has become too long? Okay, got it. How many folks think like 45 minutes has become too long? All right. How many folks think 30 minutes has become too long? Okay, we're starting to dive into this. So I don't see any folks. So no one thinks like even 10 minutes has gotten too long. All right. So I mean, it's going to be interesting for you guys to see how young folks are consuming content. We're going to use our experience about 6 to 7 years of doing this as well to show you. But so short form content is where a lot of medical education is moving, towards, and just general content consumption is moving towards. We're seeing that especially in the video space. People have a larger allowance for podcasts and audio because they're driving into work. They're taking a trip somewhere, they're walking the dog. Oftentimes when people listen to podcasts and things like that, they'll tell us, yeah, listen to you when I walk the dog every day or something like that, right? Video content in particular, if you're doing video content, you really need to know your audience. If you're really trying to target folks in their 20s and 30s, especially when it comes to video content, you can these days not have anything that's longer than like 10 to 15 minutes. That's how short that attention span has frankly become. We're not going to debate about society and attention spans and things. That's not what we're doing here. We're just going to tell you what we've seen and the trends that we've seen with the video content, audio content, things like that over the last 7 years, and how much that has really changed, and frankly it caused us to have to change how we're producing content. Did I ever think that I would have to make a 60-second clip to get to learners or anything like that? No, that was not the intentionality of all of this. We thought when we made our content, less than 10 to 15 minutes, it was a revolutionary thing at that time, because all podcasts were like an hour, and we were changing the game. But even now, as we're going to show, as what we've learned is we're having to rethink some of these things. But yeah, the other thing is short form content does allow you to get bite-sized learning and things out in a different way. So oftentimes when people are doing department emails and updating residents or updating faculty on new protocols, things like that, EMS agencies. It's been interesting how one of our EMS teams actually is now using podcasts as a way to disseminate content just in short bursts. People don't have to check email, things like that. You can just subscribe to a feed, and then they'll get like a weekly update on protocols and things of that nature. So it also is a different way to disseminate content.
In addition to how to disseminate content, it's, as he was hinting at earlier, the needs of a modern learner are very different than even just 5 years ago, like when we first started podcasting 7 years ago. And those needs are really, there's things that are internally motivating the modern learner, right? One is going to be that type of asynchronous learning. When they want to learn is when they want to learn. It's going to be that just-in-time learning theory, which is before a shift, driving into work, that's my episode, that's my time to listen. Versus the 1 day a week of didactics is the day you're supposed to learn. Some learners want to learn outside of that, or maybe they only learn outside of that. And they're only required to come to didactics because that's it. The other thing is we have the time constraints, of course. The shift work schedule in emergency medicine, but really all clinical specialties, is that time spent at work versus your outside learning structure. And finally, the cognitive overload. It's really ironic. Never before have we had access to most amount of information ever, and it keeps getting more vast. But that's also very overloading for a lot of early learners about where do I even start, how do I even learn something. Even just plugging it into AI is going to spit out scripts that are long, wordy, and not necessarily driven to help that bite-sized learning concept. So getting into the meat of this, what is a short series podcast? As he polled right at the beginning here, a short series podcast, there's no strict definition, but really anything less than 15 minutes. Sometimes these are 10 minutes long, but definitely nothing longer than 15 minutes. And we strongly support, we'll talk about why we think this should be part of a series rather than just a standalone 1 15-minute episode. And there's a lot of format options to this, no right answer. It really depends on your content and what you're actually trying to get out. But there should be some type of engagement with that learner. Engagement meaning I'm not just sitting down and I'm reading off a script of what I need to accomplish. No one's going to want to listen to that. It's going to be either I'm providing some type of interesting nugget, which is, do I start with a case? Do I start with a question that engages a learner and the learner has to respond to that either internally or externally to that prompt? And then sometimes deep dives too. All right, this is the only nerdy slide, the only science-driven slide. There's one graph on this presentation. This is it. And it's not a complicated graph. So focusing on these three theories over here, these three concepts of why short series podcasts is not just, what we're talking about here, what we think is right. There's this theory called dual coding. Dual coding was pioneered by a psychologist from the University of Wisconsin, Alan Paidio. And he essentially said that there were pioneered 30 years ago that there are two channels in the brain, they're interconnected, and they process and learn information in two interconnected but separate ways. You've probably heard some aspect of this about people saying they're a visual learner or an audio learner. This is similar to that, but really the concrete definition is verbal and visual. Verbal is simply spoken or written word. Those are those textbook readers that we all had in med school that we knew. There's always that one person in med school with you, at least for me, that was like, the person that just sat and read the whole textbook. I was like, I know everything. I'm like, how do you do that? And then there's that other group of people who were the visual learners. And by visual, though, it's interesting, because I always thought visual learning was just, you're looking at pictures, or you have to see something to get it, or watch a video. But really, it's also some type of descriptive language, which includes podcasting. So if you imagine listening audio to a case described, you feel like you're there in that moment. They're describing the sights and sounds of the room, the vitals, what's going on with the patient. You are using your reality to construct with that case. That is a form of visual learning, which is very interesting, and what that the psychiatrist was essentially positing that it's podcasting, yes, is an audio form, but it's more than that. The mental imagery, the audio cues they're using does activate that channel in your brain that processes visual information. Is it as good as watching potentially a video on doing a central line versus podcasting? Sure, we all get it, but the video form provides a little more imagery. But that podcasting is not just like a simple lecture. That's why it's different. It's different. Cognitive load, of course, has to do with the amount of information that your brain has to process at once. This is why everyone got weeded out in organic chemistry back in the day, that you were sitting in an hour-long lecture listening to organic chemistry in a big lecture hall, sometimes more than an hour. Yeah. And that's it. That's how you retain information. Your brain is never going to retain more than half of what you learn in that session, especially the more difficult the cognitive energy required to process that, it's going to take longer. And then microlearning combats this by essentially making it easier to microdose and do in small batches what your brain wants to retain. So a big topic should be broken up into smaller pieces, and this is the concept behind bite-sized learning. So again, focusing on what he said earlier, really it's going to be very small pieces of learning points. One of the biggest mistakes people make when they're producing some type of educational content is saying, way over their head, I'm going to do like 5 learning points. I think that's enough. Yeah. Always scale down. Always scale down, even if you think, gosh, I'm just going to have so much time left over. That's a good thing. You should always think to yourself, less is better. And we promise you, like, that's going to get you to a point where you're going to accomplish what you need. So 1 to 2 learning points, and then focusing on one particular topic, that series. And we'll talk about some examples here in a minute and some ideas potentially too. The last thing here about this humor and personality, you don't have to worry about like cracking jokes or being a comedic person. If you're not, that's fine. The point here is that authenticity matters the most, and just be yourself. If you're the dry person that is a deadpan humor, that's excellent. Yeah,
embrace that.
Embrace it.
Yeah.
Don't try to be somebody else. If you don't try to be the energetic, really talking person. Okay. Yeah. And that's fine. Do whatever channel, whatever you are, and then put that into your own personal design of your podcast, or again, any type of video content, whatever you're doing. This is all optional stuff, but we find that this is going to be the most memorable aspect of producing something. Reading off a script for 15 minutes straight with no breaks, nothing, is going to be very difficult to get that content out and enjoyable.
So standalone versus series. This is, so say you have a particular topic that you really want to do. A novel way to use ketamine. I know no one's ever heard of that before, right? So, and hypothetically, we're going to go with that, right? So you found some other niche way and you really want, to tell people about it. You've done the deep dives. Maybe you want your residents to do it. Maybe, again, you just want to create something so the world can know that you want this niche way to use ketamine. So you could make a 2-hour-long episode where you dive into it, you dive into the studies and all the content. That's going to get maybe like less than 10 listens, right? Instead, what you can do is create a series. So by creating a series, you're creating short 10 to 15 minutes digestible clips. And a lot of people think, oh, okay, creating the series, like this is like potentially more work, like is this really going to get out there, like maybe people want it all at once. They don't. They're okay getting things in a structured, smaller dose format. They really are. And we used to struggle with this as well, as we would even do 10 to 15 minutes, sometimes go up to 20 minutes, like, people are they going to really want a part 2? And yes, they're okay with that. They're okay with shutting it down and just getting that morsel of knowledge. The other thing that people don't realize is you are much more searchable the more bite-sized clips you do, right? So more bite-sized clips you do, the more metadata that you're going to be dropping on every single episode that you do. There's going to be a focus, a theme that you're going to have. You want your title to be focused, to have a theme that's attention-grabbing for that, again, another novel use of ketamine, that you want people to do. But within that novel use of ketamine, the why, the how, all of that, right? So the more you can have smaller morsels of knowledge and really this chapter format that's even 5 to 10 minutes long, as opposed to that 1.5 hour, the better. So that's key. That's going to also be easier to promote when you put it on social media, do all these other things. It's going to go much better.
Totally.
The other thing is when you have the script. Have a script. That script doesn't have to be just dedicated, detailed either, right? It can be a bit loose. That's all right. But you want to have some sort of script, and you want to really limit that learning objective that you're going to have per episode. So again, a good structure. You want your audience to be in like a cadence, right? You see this a lot with TV series, right? Like every TV series made has like a certain format, right? You've seen enough TV series where like, okay, this is like, they're setting up like, they usually start out with the bang, right? Which you should do. It's like that clinical example. And then the TV series will have like good characters, bad characters. All right, things are going well, and then things are going bad. And there's this natural cadence. So you want, when you separate out that episode, to have that cadence of like, okay, all right, this is that morsel of knowledge on ketamine. I know we talked about it before. This is the why. This is the how, what I mentioned before. But you want them every episode to feel like, okay, this isn't completely different, this episode that I'm in. I have a natural cadence that I'm in every episode. So like for us, even when we do like a multi-part series, we always start with that clinical scenario, even though it might be like the same topic. Is that clinical anchoring scenario is really important to us. But you choose, maybe you have something else that's anchoring to you, but something that they're used to.
Exactly. Metrics. Again, I lied, there's one more diagram, sorry. So don't look at these diagrams, these are examples of the analytics you'll get. People often care about this the most when they're creating some content for web content. And I would say this needs to be the back of your list, way down at the bottom. Most important thing is the content you make, everything we talked about so far, but I'd be remiss to not mention these terms because people always ask this stuff. When we first started off podcasting, people would ask me all the time, like, what's your download rate? And none of that matters. So explaining the download rate, you may have heard this term with podcasts. People, for some reason, always cite this as such an important value, but it really actually is the least important value up here. Downloads means essentially what it is, that how many times has that podcast episode or series been downloaded to any device, smartphone, tablet, theater, whatever. However, it provides no information on did they actually listen to it. It just downloaded. A lot of smartphones nowadays will have automatic downloads, and it doesn't mean anyone's listening to them. I'm subscribed to a lot of podcasts, and I don't listen to half of them. So that is not providing you any feedback in terms of what episodes are garnering the most popularity, as well as your feedback in terms of was the content good or not. More important would be the completion rate and the number of listens. So number of listens, all that means is anytime someone hits play, it does not mean they've completed the episode or even listened more than halfway through. They literally could hit play, and 1 second goes in, they pause it, and that counts as a number of listen. It's a misleading statistic. More important is completion rate, how often they make it to the end. Now, a lot of modern, again, the realm of podcasting, and YouTube as well, and other video platforms, they will share descriptive analytics on at what point did the listener or learner stop engaging that content. So sometimes it'll be 10 minutes into your episode, you realize that was the moment I had an audio issue, or that was the moment I talked about maybe a content that wasn't that interesting, or I shared a story that wasn't interesting. Or you notice that people are finishing every single time to the end. That's like the best news ever. That means that people are really engaged, they like the content, they're going away to the end. Or, more interesting for us, we discovered early on that people were listening, but kind of trailing off right toward the end. We realized that's a length issue. Potentially people are not as engaged, they don't want to finish, or maybe the end content of your session, it's just not that engaging. People are falling off early. Lastly, and I think the most important by far, is this listener feedback. It's, of course, qualitative, it's very subjective, but it's raw, it's most important you can get when people literally tell you what they want. And if you know your audience, this is the best form of feedback and reviews you can get. This is really helpful if you're in an academic setting and you know exactly who you're presenting to. This is your audience, this is what I'm making the content for. Just ask them before you even make it what type of structure they would want, what would they want to be engaged as, or make it and get that ongoing feedback. It's harder when you're engaging on a virtual level of who your audience is and what type of feedback there is. And that's outside the scope of this presentation. That goes into sending out survey emails, sending out engagement, as well as just allowing people to review maybe on your platform. The pitfalls here to avoid, I would say the three biggest ones. One is that, again, too much content. We can't emphasize this enough. I fall victim to it all the time. Both of us are big talkers. We like to ramble a lot too in conversation. That's probably why we do podcasts. But we have the problem of knowing internally that I am the type that talks longer, and you probably know this about yourself if you've given any talk before. You know that you're the type to either race through the presentation, I finish early every single time, or I'm the type that I have to be told to stop talking in my presentation. If you're one of those, the latter, that you have to be told to stop talking, then really overly scale yourself back. Tell yourself that you're looking at the script or looking at what you want to produce and you're like, this is so little content, what am I going to have time to, I need something more. Be reassured that that is more than enough time for yourself if you're a big talker. Rambling, again, no structure. I think some form of a script is important, even just bullet points. We don't advocate for reading off scripts. It's like the most boring thing ever. One of my biggest pet peeves when to any lecture or listening to a podcast is hearing someone just ramble on a script. But having some type of guidance of your next steps is really important, so you're not saying ums or pauses that are unnecessary, so you feel very fluid in your speech. And of course, ignoring the learner level. Most of us wouldn't make this mistake if you have any known audience of what you're producing content for. But we purposely have an audience that we're marketing towards when it comes to our content. We know for a fact who our audience is not, who we're not going to produce information for. And that really comes down to the level of information. You're not going to have good completion rates on your content if you're producing information at a different level.
Yeah, so kind of future directions, a couple other things I do want to mention. We mentioned the Spotify graph. If you are creating a podcast or content, content related to podcasting, we would really recommend Spotify. Focus on that. Don't focus on it. Yeah,
we're not sponsored.
But that's really where, if you're especially going for the younger learners, that's where everyone is at. The other thing that Blake mentioned is really structuring your content. So when we have now started, I never thought I would do this, but creating these short 1 to 3 minute long videos that we'll do, that's actually, we're trying to reach the med students. That's where they're at. That's just the reality of it. Our more deep dives that we do, or episodes that we'll do that a little bit more in depth, that's where, okay, we'll do like a 20-minute long episode now. Still, on that.
Yeah.
And even now, we're contemplating structuring, and sometimes we'll do part 1, part 2, and structure it down slowly. The general algorithms, if you want to get something out there and get some downloads and things like that, especially on YouTube, if you're doing audio and video, it needs to be like 10 minutes or less. And the more episodes and things that you can get out there, the more it's going to help. When it comes to content creation in general, being consistent with the amount of content that you're creating is the biggest thing. It took us more than a year to get like any type of traction. So if maybe you're not looking for traction, maybe you're just looking for your own learners and your own maybe residence department, or your kind of niche group, so that doesn't matter. But if you want more listens and things like that, you just have to be very consistent with how you're doing things, having more short, bite-sized learning things.
Definitely, yeah, and two other directions to take feature would be, one, to make this part of your curriculum. So again, if you're in an academic environment, you have that support level. Once you trial and make the content, is talking to your chair, talking to senior faculty, or engage undergrad medical education, graduate medical education offices, whoever your audience is, about putting this as a formal part of the curriculum. And that will really boost your audience as well as your feedback. Another direction would be expanding to other specialties potentially. Again, depends on what your content is. Other specialties, other institutions potentially that are partnered with you is a great way to take it. So just to give you some kind of call to action, kind of next steps, what you would take. This is going to be kind of where you want to take from this, right? Because you've heard us talk and you're in your head, I'm sure you're saying, oh, that sounds great, totally buy it, agree, but like the initial hurdle is hard, right? Like I don't know a microphone, I don't know certain equipment. The biggest thing is that it's really simple in terms of what you need to do. It's not like we're saying do a whole season. You're really just doing short-term, small length episodes. You can use whatever you know already. If you're the clerkship director, talk about something in the clerkship. Talk about a theme, right? We mentioned use of ketamine, which no one's ever talked about before, I'm sure. Or even just SIM, if that's your specialty, of taking that and putting it into a digestible content form. Not reinventing anything.
Yeah, that's it. I know we're at time now, but you just need basic things. I mean, even like an iPhone now, a current day iPhone can record much of this content. Don't focus on having like fancy hardware or even software, Spotify, all this stuff. Riverside is great for collaborating with colleagues. We find that we use Riverside. Blake's at Tennessee, at Wake. So you don't need anything fancy. You need to just have the topic and go for it.
Yep.
Any questions?
Yeah, no question. So you've thought about a series, you're going to do all these little short podcasts. What's your relationship to reporting versus releasing? Are you?
That's great. That's great. You want drip releases. You don't want to do it all at once. So that's the other thing we sometimes struggle is we'll do like something like oral boards or something like that. We'll do a review topic and we're like, well, we have all this content, and then we realized at first we would just like drop it all at once, and then we're like, all right, this is silly. Instead, you want to do very measured, slow releases of that content. So there's a cadence, and it also just helps with the algorithms.
So maybe like you've recorded them and then you start releasing them.
Yes.
Sort of sense.
Yes.
Like Hollywood or whatever
You got it.
recorded it and then they're kind of just so it gives you plenty of time to
Totally.
prepare.
There you go.
You can always, on the front end, sit down and do it all at once in your time frame. Because again, these are short episodes.
Yeah.
So if you got like an hour block to yourself, you could probably knock out several, depending on your topic, like several episodes potentially. And when you do that, you have them all ready, and you can just like edit them as they come out or whatever, once a week or 2 weeks.
Take your time.
Whatever. Yeah. Exactly. What's up?
This was really great.
Thanks.
Is there a recommendation as to how frequently you should drop your episodes?
Yeah, that's your question. It depends on the content who you're trying to reach. The more frequent, frankly, the better, but a cadence of usually once a week is recommended. Yeah. That's what folks are used to, at least, especially in podcasting. Any other questions?
We're always open to any questions. You can
come find us.
Find us on all the socials and just let us know. We're happy to always engage. So we've been there before. We made plenty of mistakes.
Oh, okay.
Thank you.